1 second. There we go. So, as I mentioned, this is really a session that we're going to be speaking about how to conduct digital MERL, especially because we're in a situation now with COVID that we're not allowed to group together, and people are really trying to figure out how to do things remotely. So we wanted to do some a session that would sort of share good practices on how to do that. This is one of three sessions that we're doing this week as part of the gLOCAL events. We did one yesterday about responsible use of data during a crisis. And then tomorrow we're going to be doing one about using administrative data for the COVID response. So I think a lot of you might have been on the call yesterday, and hopefully some of you will be joining us tomorrow as well. This is a collaboration, as I mentioned, between the Clear Anglophone Africa and between MERL-tech. So we have 3 speakers today. We have Ignacio Del Busto from ID Insight, Jana Roos from Humanitarian Data, and Ayanda from New Ideas. But first, we're going to have Dugan tell us, we're going to have Talitha tell us a little bit about what the gLOCAL initiative is. So Talitha, if you want to go ahead and unmute yourself and tell us a little bit about gLOCAL.
Sure. Thanks, Linda. Hello, everyone. Welcome to gLOCAL Evaluation Week. My name is Talitha. I'm the Communications Officer at Clear AA. So gLOCAL Evaluation Week is convened by Clear Initiative together with the Clear Centers networks around the globe. So we being Anglophone Africa, we have all the other centers representing in Mexico, Senegal, India, China, and Brazil. So together we are assisting organizers to foster a dialogue on M&E practices and issues that are very much relevant to their local context. And the objective for local evaluation being on raising awareness and promoting knowledge sharing on M&E practices and trends, and with the final goal of increasing the use of evidence to improve policies and programs, also to strengthen country programs, regional level M&E networks, and involve you guys as practitioners to share your experiences and your challenges, so that at the end of this event and tomorrow's event, we can document and we can improve on the way that in which we deliver our work. Thanks, Linda.
Thanks, Talitha. I'm going to hand over to Dugan now as well to tell you a little bit about the broad initiative that Clear and MERL-tech are collaborating on. Dugan, do you want to go ahead?
Thanks very much. Welcome, everybody. It's really great to see such a strong turnout. You know that there's a lot going on this week, and so we're kind of competing with a whole lot of things, and we're really grateful that you decided to join us today. I think we knew that the digital space was really important in the monitoring and evaluation field, but what the coronavirus experience has brought very vividly is that it is critical. And we at Clear have been in conversation with Linda as MERL-tech for a little while. And we had originally intended having a series of conversations based in some of the countries where we work around what it might look like if we were to develop some guidelines about how we approach data management, some of the privacy and confidentiality issues. And we were to start putting together an African set of good practices, or maybe like a charter, or something that would help people think about what the challenges are that they need to confront when they do monitoring and evaluation in the African context using the digital domain. And obviously the COVID situation put us all into a completely different space, and we've had to respond by taking our engagements online. And we haven't given up on the idea of working towards the creation of some kind of an alliance or some kind of coalition of people who work in monitoring and evaluation digitally. and who are going to start helping to shape and frame the practices that we implement when we do this work. Two of the big themes that we're especially concerned about relate to inclusion. So the SDG calls this leaving no one behind, and we want to really think about how we know that certain people do get left behind when we do monitoring and evaluation using digital platforms, and also to do no harm, because we know that when we gather people's data and we sell it and we treat them as commodities, that we are damaging them. And so those are just two of the things we need to think about. And we are very grateful that you're participating in this conversation. And we see it as a starter. This is just one dimension of the bigger picture. And we're gonna keep your details. We're gonna hopefully enlist you in more engagements. And I also just want to finish by thanking Linda, who's been so diligent and amazing and surviving a very difficult situation in the US right now. And our thoughts are with you. And we really appreciate the way you're showing up for us. Thank you very much. I'm done.
Thanks, Dugan. Yeah, I think our situation in the US is maybe something that many of you in South Africa have been through in the past. We're just behind a bit in terms of racial justice here in the US. So hopefully you can all follow and give us some good tips on that globally, how we can improve that in our context. MERL-tech, just quickly, is an organization, kind of a community, and we're really looking at how we can support monitoring, evaluation, research, and learning with digital tools, digital data, but do so, as Dugan said, in a responsible way and an ethical way, where we're really making sure that the way that we use digital in monitoring and evaluation, research and learning is not putting people in harm's way. And so that is really something we've been thinking about a lot. How can we as a MERL community very intentionally shape the way technology is moving into our space and be quite clear about how we want to make sure that we're protecting people, we're elevating people's voices when we're using digital tools, and we're not leaving anyone out. So that's kind of a strand that weaves through all of the different work that we've been doing as MERL-tech. So having given you all of these different introduction points, we're going to start in with our speakers now. As I mentioned earlier, we've got Ignacio Del Busto from ID Insight, we have Jenna Roos from Humanitarian Data, and we have Ayanda Tanyana from New Leaders. We're going to start with Ignacio, then we're going to have Jana talk to us, and then Ayanda's going to talk to us, and then we're going to have a question and answer with everyone here. So as our speakers are speaking, please do drop any questions that you have in the chat for them. I have some questions for them as well that I'm going to be adding into the chat for them. And we really want to make this as participatory as possible. We want to hear from all of you who are on the call with your own good practices, your own experiences, any challenges you're facing. And we're going to be recording this session, as I mentioned. We'll be taking notes as well. And then with these 3 sessions that we've done yesterday, today, and tomorrow, we'll be putting a report together. We'll send that out to you along with the recording so that so we can start to kind of build on the experiences that you're all having in the region, and thinking about ways that we can kind of move this space forward. So I am going to hand over to Ignacio. I'm going to take the slides down so you can have a more personal experience, kind of face-to-face discussion here. And I will drop the slides and move over to you, Ignacio. Let me try to figure out how to.
Thank you so much for the introduction, Linda. So I'm going to try to be very brief, because I think that the most useful part of these sessions is on the dialogue, the conversation, the questions and answers. So I'm going to leave most of my time for that. But I think it would be helpful to give an introduction of some of the work that we have been doing on remote data collection before COVID-19, and how COVID-19 has increased the need for that kind of work. So just as for some context about our organization, IDInsight is an international non-for-profit. What we do is to partner with social sector organizations that could be governments, multilaterals, NGOs, foundations, and so on to generate and use evidence or better evidence in the decision-making processes. In terms of the principles or like the gap that we are trying to address in the space is that probably there is a lot of research that gets generated in the international development space, but a lot of that research feels a little bit limited to maximize the impact of organizations on the ground. And that's for a couple of reasons. The first one is that a lot of that research doesn't put in the center the critical decisions of the organizations on the ground. So maybe it's like a little bit generic or like, for a specific region or for a specific sector, but working one-on-one with like these organizations is usually lacking. And the second angle of the limitations has to do, like, even when that research gets produced to answer the most critical questions of specific organizations, very infrequently that research is balanced with all the practical aspects, right? And we think that is very important, like, to as important as having the right level of technical rigor to make sure that you are telling something that is truthful, is also thinking about what are the constraints that decision makers have to first, generate some kind of evidence and also to use that evidence. So, what are the timelines that they are demanding to make a decision? What is the budget, or what are the resources that they have to do any kind of measurement? What are like their operational and political constraints and so on. So just to recap, like the approach that we bring is like, first, like, to make all our engagements very demand driven. So we are answering the priority questions that organizations have on the ground, and also balancing the technical aspects with all the operational constraints that at the end can make the difference between using the evidence or not, or generating the evidence that is most appropriate. Within this context, we have developed a wide range of tools, but one of them that I wanted to talk about is what we have called data on demand. And this basically came from our work with the government of India. A typical problem that a lot of policymakers have, and many of you in the call can relate to this, is that you have like sometimes very niche, concrete questions that require very precise evidence or very precise data. But that data is infrequently available, and that's usually for a good reason. Like launching a data collection operation is very costly. It takes a lot of time. Like you can think about a census, and it wouldn't make sense to collect or to embark in one of these massive data collection efforts every time that you have a very niche question, right? But it's still, like, there is like the need of having like some information to improve the decision-making processes and so on. So the challenge that we have there is like, how can we make compatible generating information that is very needed by policymakers, that is usually about a needs kind of question, and also to make that compatible with collecting that information in a cheap way and also in a quick way. So it's effective at generating that evidence within the constraints that our counterparts usually have. So with this, what we try to do is to generate a number of approaches, or to experiment with a number of approaches to optimize in these two fronts, right? And what we started doing was, with this data on demand initiative, was working with the communities, pre-training some data collectors in these communities. So we'll have them at the disposal of these kind of engagements to be mobilized very quickly and collect very niche information, typically using their smartphones. Like, they will send that information to us. We'll, in many cases, triangulate the quality of that data in a number of different ways and very rapidly feed it for decision makers to make a decision, right? This need for having more of a quick and cheap response in the data that needs to be used in the decision making has only increased with COVID-19. So we have seen that, on the one hand, data is more needed than ever. Like, there is a lot of uncertainty along many dimensions, and data plays a vital role in that landscape. Also, like, there are like some complications regarding doing data collection in a traditional way for obvious reasons that we all know. And finally, like, there is like this pressing need of responding like very quickly to these demands because of the nature of the problems that we are trying to navigate. So what we have done is taking this work that we have done in data on demand, trying to apply that to answer the questions of policymakers in the current circumstances. And this is not, as you can understand, there is not free of challenges. Like, there is like a lot that we need to figure out and move towards to respond to these needs of policymakers, and also on the present needs of many actors in the international community, donors and so on, that are rotating towards COVID-19 and to remote data collection and usage. Some of the lessons that we have been learning, I will be very curious to discuss with the rest of the group, but many of them have to do with how can you sell at collecting data via phone surveys, for example, and how can you make sure that that data has the right level of quality. A lot of the typical processes that we have in typical data collection on the field, they need to be refined, or they need to be some new thinking about how to approach those. Just to give you some examples, like, of course, you cannot train enumerators in person, so that has some kind of challenges that we have been experimenting. Also, is like, can you reach all the target population that you have? How is the lack of availability of connectivity impacting that? What kind of external validity or conclusions we'll be able to draw for our new sampling framework? How do you develop a sample framework? How do you make sure that people, like, engage in these conversations, and they are and you can conduct data collection operation that they stay on the phone and so on. So there are a lot of questions in these areas that I would really like to discuss during our conversation. I'm gonna give a few nudges in the next couple of minutes or so, and I'm very happy to go a little bit deeper in the round of questions and answers. But the first thing that we have seen is that it's very important to have an experimental approach on the questions about how can you reach out people on the phone, how can you get them to stay on the phone and provide information and data. Some steps that we have found useful are threefold. Like, first one is having a very clear tracker to understand what are the reasons why you are not reaching out to responders. Are they staying on the phone? At what minute they jump off or they disconnect the call, and so on. So having an experimental approach and trying to capture that information is really important. The second one, and it's related with the first, is developing some kind of protocols that allow us to know what approaches are more effective. And some of those protocols cover things like, at what time you should call, what is the ideal length of these surveys, how many times do we need to call back, what are the procedures that are working better to get people back on the phone, and so on. So all of those questions are a little bit empirical, and they depend on the specific project, and I said that's an important point that I wanted to make, to understand what are the realities and what protocols are working better within the constraints. The other point is thinking about what are the limitations from our work. And I have mentioned before that, one obvious one is the connectivity, what people have, or what characteristics have the population that have phones versus those that don't have phone. Do we have any census data to know, what percentage of the population we are reaching, or will be able to infer something from these surveys? and so on. So like thinking about the limitations, I think what it has been mentioned before, like, there are some specific aspects that are important. Like one has to do with confidentiality and also don't harm. So first, are any types of questions, because they are very sensitive, but we cannot ask on the phone. I mean, you can think obviously about gender violence and being unintended consequence of this word that maybe is more prevalent in the case of phone surveys, or you can control less than if you were doing in-person surveys. So that's an important question. And also, like, trying to experiment with what kind of questions are you going to find an answer for, and what kind of questions are not a good fit for this kind of remote data collection. A final point that I wanted to close with was that it's not only about phone surveys. We are seeing that there are a lot of promising tools. Here in South Africa, you might be aware of the work that Health Alert has done. In essence, it's an initiative by Prakel.org in collaboration with the World Health Organization and also many governments in the region and outside the region to, one, communicate some important lessons and good practices about COVID-19, but also a way of collecting data. And I think in South Africa, so far, 800,000 people have reported symptoms that way, which have been able to collect some data the government would have not had access to in a very evident way otherwise. So there is, like, that big opportunity of this COVID-19 emergency, making us more efficient about these remote data collection methods, and also to see a future even beyond COVID-19, where we can devise and refine some tools that had not been worked on very intensely before, and to try to make that the quality of those better, and also to make the response of those better. So I see a horizon of this COVID-19 pandemic to changing the landscape and the way that we are working in the management field. And I'm going to close it with that for now. I'm very happy to answer any questions.
Thanks so much, Ignacio. We've got a couple questions in the chat that maybe you can take a look at while we move over to Jana and start thinking about maybe any responses. And I think Jana and Ayanda, you might also have thoughts on the questions that are starting to come through in the chat. And other people as well, if you do have good practices or thoughts on how to address some of the challenges coming up, there'll also be a space for you to either answer questions through the chat or through the call. So I'm going to hand over to Jana right now, so she may have thoughts on some of these things as she's talking through her presentation. Go ahead, Jana.
Perfect. Hopefully my sound is coming through okay. Is that okay? Great. So yeah, I was kind of thinking through remote monitoring is a pretty big topic, and where do I start when I kind of think about, what would be the top things I would want to talk about. So I've been doing remote monitoring since about 2014, using mobile data collection and working through with a variety of partners and agencies in both the Middle East, Africa, and so India. So I had kind of a list of 6 or 7 things that I kind of wanted to go through, and I'll try to make them quick and easy to follow. But the very first thing I think that I learned about remote monitoring is that it is all about humanity. And I think we have to remember that and start there, because remote monitoring depends a lot on technology. And the very first time I kind of ran a remote survey, we had developed this really complex questionnaire, and it was well constrained, and it was digital, it had calculations, it had randomization, and it had a lot of it was very, very complex. And then we just stuck in a little question at the end that said, is there anything else you'd like to say? Open-ended. And people started sharing their stories. And because of the crisis we were in, a lot of people had these stories to tell about what they were experiencing, what they were going through in the crisis that they were in. And no one had just taken the time just to listen to their story. And so I think if I start anywhere with remote monitoring, I think from a very practical perspective is no matter what type of technology or what type of monitoring you're doing, it's always focused on humanity. And I think just that story has stuck with me, just reading through those stories of what people shared. So humanity. I think the next thing, and I'm just going to use some props just to keep you with me here. So how you measure. So the methods you use to measure in remote monitoring, I'm going to represent that by using my phone, my mobile phone. Whether you are going remote or whether you are using Zoom or whether you are using a mobile data collection or whether you're using WhatsApp or Facebook, the phone or technology kind of is representative of what we depend on when it comes to methods to use in remote monitoring. And I think in the short term, you can basically say, you know, this was our monitoring plan or evaluation plan before coronavirus happened, and how are we just going to carry out those exact same surveys or methods using technology and data. So we're just going to take the same focus group discussion that we had planned and we're going to put it on Zoom, or we're going to take the exact same survey we had planned and we're going to run it remotely using web surveys instead of going to people's houses or phone calls. So I think that's totally necessary in the short term. I think in the long term, and coronavirus or other crises will cause of us to be forced to do remote data collection and remote monitoring. But I think what we kind of need to think in the long term is talk to the user and figure out, are there better ways of monitoring the exact data that you need instead of just taking what you had planned and using technology to run it. So I think in terms of methods, it's really about this, but it's also thinking long-term, are there better ways? So, you know, is it getting into fun ways of monitoring using sensors that give feedback, or, you know, can you design those right into your program? I think the second thing to think about, and I'll just pull up a photograph. So I think in monitoring and evaluation, often what we do traditionally is take a snapshot, or we're trying to gather a snapshot of sorry, I have a timer up here, a snapshot of data. And when we're going to remote monitoring, we are not present kind of in that moment. We can't go and observe. So kind of during all of that delivery. So we're forced, I think, to collect ongoing data instead of only seeing a monitoring practice as just a snapshot in time. So instead of just going out and collecting, you know, impact data, so what is kind of the program impact that you have created, you also kind of need to think about the indicators of your program, like how is it being delivered? Because not only is monitoring going remote, also program delivery is going remote. You know, I've been involved in a program where we're running face-to-face training. All of a sudden in coronavirus, we can't run face-to-face training. And so as we go and experiment with different ways to actually deliver that program, our monitoring isn't just going to capture, you know, what's the impact of our program, it's also going to capture, well, what's the impact of this delivery style versus the other delivery style. And to do that, we've got to have ongoing monitoring. So I'm not just collecting a snapshot of kind of what's the end result, but I'm collecting kind of what's the ongoing internal quality indicator of actually how we're doing that. I think though, very specifically in coronavirus, health and safety, so kind of looking at how are our programs being delivered and are we you know, following health and safety rules. That's a really practical indicator to measure for internal quality. I think you'll also have accountability questions like, how do you prove that that an activity actually also got carried out if you can't actually go and observe as a monitor? So I think those are the kind of questions. using things like GPS, triangulating your data, and using photos and videos just to give you a sense of observation, even when you can't be present. Kind of the third thing that I brought was my TV remote control. So I think when you have a TV and just has a button, it's like on, off, and that's very simple. And the remote control was designed to do that remotely, but it's like super complex. And I think that's a little bit the difference between, if you go and you have an interview with someone, it's very simple to sit down and have a conversation and an interview. And yes, there are loads of principles that we use in monitoring, but I think the complexity that we add is more around the data and technology aspect. So all of a sudden, a simple conversation gets quite complicated. How is the technical design of your questionnaire? So I think the third thing is around skills of your team. And we have built up teams that are quite good at monitoring principles and at having conversations, but a lot of us don't have, big data teams. And so I think another question we have to think about is, do you hire in those skills, or do you build them up in your internal team? So yeah, I was just using this just to kind of say, it is a little bit, the complexity is different, and our skill sets aren't necessarily built up to really look at data and technology. I think that then the other thing that I wanted to talk about was localization. So I just have a mirror. One is a lot bigger than the other. So it's just a magnifying mirror. And the mirror just represents that actually we are looking from far away, but actually the people who are actually doing the delivery are on the ground, and it might be street networks, it might be community-based organizations, and they're often organizations that haven't been relied upon for such big programs before. We transfer risk. Bigger organizations transfer risks to local actors. And so I think that's another big thing we have to be aware of. How do we deliver aid well? And then how do we protect and monitor smaller agencies or smaller individuals who are delivering on that end, on the end of that program. And then people have already kind of mentioned this before about access. So I have 2 children, and so this is a little bit of a teddy bear. Okay, so this is a stuffed elephant. Children don't have phones, and I was thinking about this quite a bit. Is that, are we excluding children, youth, or women who typically don't have as much access to technology as male counterparts in our communities and individuals in our programs? So I think we have a possibility of introducing bias in who we monitor, as well as when we are remote, we're unable to observe whether vulnerable people are in a safe place to talk. And Ignacio already kind of mentioned this. So I think access, and using kind of that teddy bear to remind you that people don't have the same access to technology. So when you're using only remote technology sources, you are allowing people to slip through the radar. And I think that's really important, especially depending on what kind of program you run. I think the other thing around a phone survey is people self-select. As Ignacio already said, they self-select who answers their phone. So typically I would do kind of a random selection. When I'm doing a methodology, I might do a random selection of who I go and talk to. When I use the phone, half your people might not even answer your phone anyway. And why are they self-selecting not to answer? So I think that's a big challenge that I've really seen come through quite a lot. And then lastly, I think ethics, and using kind of a magnifying glass to look very closely at the way we monitor data and what we do with people's data is really important. So doing no harm obviously is a main principle in all of our work. But when we're now forced to deliver programs remotely, we're actually forced to do that in new ways. So we are literally experimenting with new ways of programming. And I think experimentation gets it's great, but it's also, we're experimenting with people's lives. We're in a health crisis, and we're experimenting. And yeah, we can see that kind of playing out with governments around the world right now. Governments don't know what they're doing, so every government's trying to do something else, and some countries are having better responses than others. And so I think as aid agencies or development organizations, we also need to think about how are we using monitoring to make sure that we're not doing harm and that we're not experimenting in ways that are harming people. Digital communications are usually directly between a staff member and an individual or a group of individuals, and there might be a lack of oversight. So there aren't, necessarily a whole bunch of other people watching. And so I think we need to have something in place, like a complaints hotline or a way for people to be safe, even though they're one-to-one in a digital forum, or yeah, that's something like that. And then also we do have to think about the protection of our staff. It is, again, a crisis, and they may be exposed more than normal to health risks. So thinking about that, as well as data protection. So where we are sending people out into a community to deliver a remote program, how do we monitor that they're doing that safely? And then how do we protect that data once it comes back in? And that has a whole other realm. Sorry, I've probably gone too long. I had to shut my timer off because it was like making my computer freeze. But yeah, I just wanted, sorry, I used the props, but it was just to try to think through, like, actually we have these multiple different concepts in remote monitoring that I think we have to think through as practitioners, because it's not just about creating a mobile form and sending out a web survey. That's for me.
Great, thank you so much, Jenna. We've also got some great questions coming in on the chat. One question I would love for you to think about as we move over to Ayanda is really, one of the big questions I've had is if we've moved from sort of institutional settings over to home settings, and people were kind of very quickly, rapidly forced to start working from home. People might be using their own devices to collect data, to reach out to people. So I have a big question about how do we start kind of institutionalizing contact that organizations or evaluators might be having with communities so that we're not, having a lot of data collected on people's individual phones that normally would be within an institutional setting and would be protected more than it is now. So those are some of the questions that I've got coming through my head, but there's also quite a few great questions in the chat that I'd love for you and Ignacio to take a look at, so we can think about responding to some of those after we hear Ayanda. So Ayanda, I'm going to hand over to you now, if you're ready to go.
Thanks, Linda.
Great.
Good afternoon, everyone. So on my side, I'm actually going to contribute to the discussion by speaking to a remote monitoring approach where there is decentralized data collection and reporting. So that is the actual different sites where people might be collecting data. And as they collect and report on that data, they're actually reporting to a common system or a centralized platform for usage at various levels. So this is actually an approach that we use a lot within the education space. So for instance, in the public education system, we have got school administration software that is actually at each of the different schools. And our effort over the years has been supporting the Department of Basic Education get that data from schools, and it gets aggregated at various levels of the system. So at circuit level all the way to national. It's consolidated and aggregated for understanding the depth and as well as understanding what the system looks like at different levels. So that's what we've been working on with the public education system, but we've also worked using a similar approach with civil society and private sector programs that are driving interventions in education. And it has been a similar approach where different implementing agents are using a tool to track, and as they're using the tool, that tool is also reporting to their stakeholders. So I think for one, we believe in this sort of approach because it actually does enable us to collect data at scale. You share the task of data collection and reporting across the different sites. So it's actually not sitting on single individuals, and that becomes very critical if you're dealing with 24,000 plus public schools. And the other part for us where this approach actually works isn't that the owners of the data are able to use the data themselves and are able to generate insights, so that the data is actually useful not just for the people that it's being reported to, but it's actually useful to the person reporting. And I think for us this resonates very deeply, because our activism is in democratizing decision making, and that individuals who are owners of the data actually are empowered to make decisions on their own data, and they can even engage with other stakeholders that have access to that data. And as well as it's a part of our broader effort to build a data-driven culture within education. So given, I guess, the picture that I've created around the type of work we do, you'd understand that our biggest challenge in the context of COVID-19 is that the sites have been abandoned. So so it's like a site-based system. It requires people to be at site and then be reporting. And this has proven to be the fact, particularly with schools. And you would know the biggest question is, when are schools going back and resuming within the South African context? And the South African system uses a tool that is actually based at the school in order to get data. So as long as there's no principal or someone at school, they can get data. And that's been I guess the biggest challenge with the MERL system in South Africa, that it's actually a bit archaic. A principal can't use their mobile phone or a tablet that they've been given by the department to report the same information that they need to be at school for in order to report. So in thinking about school readiness, the department had to switch to other methods where they're using telephonic interviews, they're issuing online surveys, and they're not using their existing infrastructure, just because the sites have been abandoned. It's been a bit better with civil society, which is, I guess, to the point that Linda mentioned. People began to go home and start working at home and using their own devices and resources in order to continue work. And that's been the case with civil society, and the platforms that we're using with civil society, they are such that they can actually use the internet in order to continue providing information. So I think that the issue around sites being abandoned, I think it's been a biggest challenge, particularly in establishing school readiness. But I think as schools reopen, the Department of Basic Education will then begin to use its own systems to collect information. But at this point, it had to explore other methods. But I'm also just gonna close by just speaking about just general challenges that that are faced when one is going for this decentralized approach. So some of the biggest challenges are actually about buy-in into the use of the tools across the different sites. And this is what we found as well when the Department of Education rolled out SSMs across different schools. Because there was no buy-in and understanding by the schools, what ended up happening was that schools were not using it to report. At some point, there were very few schools that are reporting compared to now. And then the second part as well is that typically people do not even understand the change that is asked of them. So not just buy-in, but just understanding practically what is being asked of you. And I think that's been the case as well, where you find that a solution is developed and rolled out, but the people that are supposed to use it at site do not fully understand it and do not fully understand where it fits into the broader M&E framework. And there are duplicate processes, and it's not understood when will we move from the Excel spreadsheet or the paper-based instrument that we're submitting. What are some of the transition points? And so that's been almost like it's also a big challenge whereby people don't understand that change and it's actually not effectively communicated. And then a third one is actually knowledge and skills around the use of that M&E system or that digital solution. So what we've found as well over the years, the systems that typically, which is typical, I guess, of incumbents, is that because they work with hierarchy and work with compliance, they will give an instruction that this is the tool you use and this is the manual. No equipping, no training, no support provided, but it's an instruction that this is now we've switched over from this using these tools, we're using this tool. What that leads to itself is that you'll have early adopters that jump on board and then comply, but you'll have others that are just doing things to tick a box. And that's what happens then where you end up getting data that's not reflecting reality. So for instance, some of the data that's collected at school, which is around attendance, the way that data is collected on attendance, it assumes that you will actually have the learners coming at school. It's just going to be a few ones that are being absent. And therefore the default is that learners have attended. If you've got someone who is not interested in capturing that information and is not brought into the system, they would just tick yes. And then by ticking yes on the platform, they actually say that everyone was present without necessarily ticking and updating attendance. And therefore you've got data on attendance that is not a true reflection of reality. And you also get imagined practices whereby some people get stuck and they figure out workarounds where they'll give you, and then I remember one of the fields, people told each other that if you just put one, you can pass that step. Not understanding what one means, not understanding the implications of that from a reporting perspective. So I guess what I'm highlighting is that when you haven't trained people don't have an understanding of the system, an understanding of the data that's required of them, and the data practices that are supporting that data. What you'll find is incorrect data, incomplete data, people just doing things out of compliance. And I think the last one around like the biggest challenge as well is that what you find is that there are also processes and practices that are not necessarily enabling and are supporting, the adoption of that tool. So like the one I mentioned is that you have a duplicate data collection process. So people are filling different instruments with common data as an example. So what you'll find is that people will just copy what they put in the other one and give you that one because they're like, you don't know what you want. And this is also what we found a lot in earlier years in education, where the principal will just resubmit what they submitted because firstly you don't talk to them about what they submitted, and secondly, and secondly, like there are no consequences to not submitting that information, and then people just tick the box. But when you've got defined processes, and then there are practices as well, which is what I also mentioned earlier on around, people are benefiting from the data. So there must be data-driven or data or evidence-demanding processes that depend on the systems that lead to these systems, being used and for people to derive value. If there are different processes, if, for instance, in a meeting, you're no longer using the digital solution, you're using paper-based tools to engage, that's what people will focus on. They won't focus on the other systems. So it's important to have those processes in place. So what I'll end with is that it's a few points around some of the good practices that we've picked up along the way in doing some of the work that we've been doing in education. One is around the fact that the solutions need to be developed with the users. So in that, the way the systems are developed, one, they need to take into account how users engage with that type of information and how users will then respond. And it needs to not be selfish. And that's what we've found a lot with some of these centralized platforms that are decentralized. They are looking at the lens of what data do we need? The other question is like, what data do those users need and what data can we get from the data they need? And therefore the digital solutions are also serving their needs. And it's about them sharing data with you based on them fulfilling their needs. So it's very important then to design solutions with users in mind and also serving the users' needs. And therefore then the data gets populated again and again. And then the second one is that systems need to be interoperable. So meaning that systems need to be speaking to one another. So there's data that is captured and is sitting in other systems, and what tends to happen is that there's deployment of new systems and new tools that ask overlapping data. So systems should be speaking to one another. And as systems speak to one another, then the data capturing burden is lessened for the different sites. And over and above that, when the data, almost like when systems are speaking to one another, what will also happen is that you'll find a lot of data up to date. So I'll give you an example, which has been the biggest challenge right now, even in switching to telephonic interviews to gather data, is that telephone or cell phone numbers or contact details of principals or other people in the field are not up to date. But if that data point was interoperable and it was accessed through various systems, then it would actually have the latest data. If it was, for instance, it was part of a telephone that is used to call principals on an ongoing basis, would always have the latest phone number. But because there are different systems collecting different data at different points in time and they don't even speak to each other, what you'll find is outdated data. And then I think the last 2 points is that you also need to then establish data standards around the type of data that you're collecting, so that there's a broader understanding of what that data is, and different systems can capture and gather it the same way, so that that interoperability can actually come into effect, and then we can realize benefits. And lastly, it is very important that whenever then one is rolling out these solutions at different sites, one needs to see the act of rolling out that solution as bringing about change. So a well thought out change management program needs to be designed that is able to help people understand the change and be convicted to change. And secondly, there are clear processes that are enabling and are supporting people to change. And thirdly, there is a set of capability building programs that help people to be equipped to do what they need to do. And lastly, there's role modeling through practices that reinforce what is required, as opposed to having certain practices by leaders that are not necessarily taking advantage of what people are doing. I will pause there, and I'm happy to engage further, and I've seen some of the questions about the data. Thank you.
Thanks so much. Let's stick with you for just a second, Ayanda, because we had one just really quick clarifying question. What's the name of the system used in South African schools? You mentioned a system.
All right. So the system is called SA-SAMS, so South African School Administration and Management System. So that's the system that is freely available to all public schools. However, schools that are independent, as well as public schools that have some funds available, they procure third-party systems that follow a similar standard. And there's quite a number of third-party systems that are available in South Africa as well, which are typically better supported than the public system. And then there's also then a data-driven districts dashboard, which is pulling data from this from SA-SAMS, and the data-driven districts dashboard is what then aggregates that data at different levels and is accessible to officials in the department, as well as civil society organizations that are working with the department.
Great, thank you. Okay, thanks, Tikwisa. So I've been collecting the questions that are coming in the chat, and I've tried to divide them into a few different categories. So we have some questions that are around kind of methodology and technique and technology. We have some questions around inclusion, and then questions around do no harm, and how can we make sure that we're not harming those that we're collecting data from. So maybe I will start with some of the methods and techniques. I think one really important question that's coming up is, now that everything is remote, how do you actually conduct training for your enumerators or your people who are going to be doing remote data collection? How are you doing remote training for them? And you mentioned also the importance of training and sort of understanding the full data picture and the full process, so that the data is high quality. People aren't just doing tick the box exercises. They're not finding workarounds. So I guess question for any of you, Jana, Ignacio, Ayanda, around enumerator training in the time of COVID. How are we going to do this?
So I think something that has worked for us, and we tried different approaches. And number one is working with enumerators that we have previously worked with. So that has made things easier. The training itself has taken place in a form of combination of pre-recorded videos that we will send, and also some Skype sessions to build on those videos. Something that I would like to emphasize also about the training is that this new reality requires new emphasis of that training. So for example, what we have seen is that doing consent forms over the phone is way more difficult. So that's something that is linked also with the ethical response, and something that we have seen that we need to emphasize even more during the trainings. And also some of the practices that have been always very important, keep being very important. Like for example, the briefing after the days is very critical. Now we ask from data collectors, not only that they collect the data, but also that they are very specific, tracking the reasons why people discontinue conversations and why they don't reach some of the respondents and so on. So that part is very critical, and also it's very critical to link that with the briefing. And finally, there are some pieces that require ad hoc kind of training or like, a different way of approaching the work. One is on, spot checks. So definitely we are not able to show up in the houses of the enumerators and listen to a call. So what we are doing is to record those calls, and after that to go like, through a process of reviewing a random subset of them. Another aspect that it could be like very specific is we have been, and this has to do with the privacy and the ethical part, but the part that we saw that it was very critical is that enumerators phone numbers that they were using after the interview, and that responders didn't have access to the phone number of enumerators. So what we have been using is different software approaches that allows you to mask that information. So those are some aspects about training.
Okay, so you cut out just a little bit, but I understand you were saying you're using a software that will disguise the phone number of both the enumerator and the respondent, so that information is protected.
Yeah, yeah.
Okay, great. Thank you. Yeah. What's it called?
I'll put the link on the chat.
Fantastic. Thank you. So another question that's come through is, how do we ensure that data that's collected through remote data collection is actually complete? How do we pick up on verbal cues? How do we account for this when we're doing analysis and reporting of data? So I'm wondering if anyone has any thoughts around, how do you manage just a phone conversation, a remote conversation, when you're really missing out on a lot of context?
That's a really hard one.
Mm-hmm.
There's not like a big answer. You do miss out on context. I could try, unless somebody else wants to jump in. I think what I've tried, at least personally, and other people can kind of give their experience, but I try to create, so I think when you're remotely collecting data, a lot of it comes back as quantitative data. So it's usually pretty structured, in a spreadsheet. Whether it's high quality or not is something you kind of have to figure out. I think, first of all, is just making sure that you know what you want to observe when you're kind of collecting, and is there any way to observe that? So if you want to capture an audio or a video or a photo, or it kind of depends what your context is, like make sure you kind of design that. But also I think it's about creating a picture through data. So creating a picture of the context, and it's not about data collection as much as it is probably about data visualization. So the faster you can get that data into maps, spreadsheets, or bar charts, pie charts, whatever you want to be able to actually interact with the data, your mind will all of a sudden start to see anomalies or ask questions around why is that like that and why is that like that. And I think that's when you can kind of go back to the enumerator who actually carried out the survey, or go right back to the person themselves and say, hey, this looked really interesting or funky, can we talk about this a little bit more? So I think that's kind of what my approach has been. So it's about collecting observation data where you can through media. But it's also then around letting your brain use quantitative data to kind of tell you where you need further qualitative data, because something doesn't look logical.
I
don't know what other people would say.
Yeah, I think it's an interesting point, because I think a lot of times we think that when we add technology into things, everything becomes much easier and we can just kind of do it quickly and move on. And I think that brings up the point that that this is still just as hard, and you still need to be as engaged and involved in looking at different types of data sources and really questioning the data that's coming in for, as you said, anomalies, things that might not look right, and then going back, just as you might if you were doing normal non-remote work, thinking through all that. I'm going to take one more question that's on this sort of methods and techniques part. And I wanted to ask you, Ayana, there's a question about, I believe it's around some data management or knowledge management systems. If you have any thoughts, or if anyone on the call has any examples of good knowledge management systems that integrate with MS Office Suite, with Google Docs. What kinds of things do you need to think about when you're designing a knowledge management strategy? If you would drop those into the chat, since I think that's more of a technical question. But the other question is, someone has asked, what do you mean by data speaking to one another? And that was right after your talk, Ayanda. So can you talk a little bit about kind of data interoperability, or kind of how you're looking at these different data sources and how are they kind of speaking to each other?
All right, thanks for that. So, and I think technically it's less about data speaking to one another, but it's more systems speaking to one another. And secondly, I guess the idea there is that different systems may be collecting different data for different reasons. And I guess which is the whole idea that systems should, or any data collection exercise should be getting data for what they need. But what tends to happen then is that you may want data from that already exist in other sources, and how do you then leverage those sources instead of asking that information again from people, and therefore in your data collection you're actually quite minimalistic as well. And I think, and practically speaking, I think a biggest important factor for this is unique identifiers. So being able, so for instance, if you're looking, and I'm also going to answer another question about teachers, about the data that we collect using this question, where we collect learner attendance, we collect data on teacher attendance and learner performance, etc. And the information about the teacher for instance, in SSMs, can speak to the information about the teacher in the parcel system, which is about the teacher as an employee within the system. And you could use unique identifiers to identify the same teacher across the different systems in order to have a complete data set, as opposed to be collecting the same data that's on the parcel system using the SSM system. So unique identifiers are a critical issue, but the limitations does become, so for instance, when you begin to broaden that to use national IDs and you have people that are not documented, and if your work is around those people and then they don't have the national IDs, you then need to think about and figure out ways of establishing unique identifiers for that specific project. But essentially it's about the systems sharing information with each other, and it's important that in order to be able to share the information that you use unique identifiers. And as well, I think the last point is that even that information sharing should adhere to POPI or any data sharing acts as well, because the information is collected for a specific purpose, and therefore whatever that information is being shared for should still align with the broader purpose.
Great, thank you so much for that. Another question, I think let's move over to the general questions around inclusion. And I think there are a lot of concerns around inclusion because people might not have access to different types of phones, especially smartphones in rural areas. There are some questions around language and literacy. How do you conduct surveys if people would normally need some type of translation in order to participate? So how are we dealing with some of these? And we may not have answers at this point to a lot of these questions, I think, because this is a new challenge. But if anyone also has, anyone on the call has examples that you want to drop into the chat, that would be great too. But so really these questions around access to different types of, access to bandwidth, access to data credits, access to smartphones that are required, and then these issues around language and literacy. I would love some thoughts on that from speakers, but also from folks that are on the call already.
Yeah, something that has worked very well in our case is to make appointments, just to make sure that we are figuring out some of those aspects, about the language. It has also increased dramatically the response rate. And arguably the quality of the information, if we think that there is any correlation between the response rate and the information also will have increased. So I think that's something that has worked well with us. In addition, I think triangulating the data that we are getting, or knowing what are the demographic characteristics of the respondents is very, very important. and it could speak more about like, you know, those data quality aspects too, but also to get the right insights, we need to know what kind of population we are reaching out to, right? I don't see that this necessarily a problem. Like, you know, it's just we need to know, like, you know, what kind of population we are reaching out to, like with each method, and what population we are leaving out to draw the right conclusions.
Jana or Ayana, do you have any thoughts on that?
Just if I can just make a couple of observations, and these are just thoughts to add to the discussion really, but one thing I think is around, are we considering different program styles? So you know, typically if you run a program, you're running a program on, you know, maybe gender equality or something. I'm just throwing something out there, but we typically don't think of, you know, we're gonna run an internet connectivity program alongside of our gender program. And I think, you know, I've seen this previously where we were faced with a remote programming, is that we are actually given funding to create an information management team that was as big as our, you know, shelter team, for example, because the data side of it was so important in a remote context, and because it was purely remote, you know, that is that. And so I think thinking outside the box in terms of, could you just get funding for a program that is just around, you know, smartphones and access to internet and that kind of thing. And secondly, I think when I was talking a little bit about localization, I think coronavirus hasn't got us all shut up in our houses. It has decreased travel significantly, but there are different availability of meetups in different countries, and that kind of depends on per government. But you know, in one of the countries that I'm working in right now, you know, we're allowed to meet in groups of 5, and where you would want to still social distance, but it's not just about phone. So if you have groups of people that definitely cannot have access to technology, then how do we go and actually, you know, provide the time and space for small groups of monitoring and kind of really just looking at everything available to us. So remote isn't just about a change to technology, but remote is about a change of the way we do monitoring to allow for the new constraints. So I'll just throw those couple things in there.
Oops, Ayana, do you have anything to add on that piece?
Yeah, I think the one thing that I think I'll add on my side as well is, I guess, speaking between the balance of the need for that information and I guess what that information is required for, and also you know, what other methods are available to respond. So, and I guess what I'm alluding to and speaking at is that sometimes it's okay in certain instances to use a community-based approach for data collection. So in the sense that you're not thinking of a respondent as one person, but you think of a respondent as a member of a community, and maybe one person in a community might have a phone, or maybe one person in a community may be able to, you know, articulate the needs of that community, especially in times like this, where some of the needs are speaking to health and safety measures. And it's also and then I guess in a way what I'm saying is, like, to a certain extent, it may be okay to have a community-based approach to a data collection exercise, especially when it's speaking to certain needs and answering certain questions in times such as this.
I think that's really interesting thinking, and you know, maybe even how do you combine sort of a community-based approach, looking at who's being represented, you know, at who's representing the broader community, and then maybe some follow-up with individuals to kind of second check whether that, you know, that reporting back is valid. So that's quite interesting. There's a question as well about you know, people's views on providing phone credits or data for people to respond to things. So that's one question I'd love to hear from you all about. People have put some thoughts in the chat as well about whether they're using it or not. And then another question has come in, or it's not even a question, but some really great experiences are coming through on the chat about people that are using WhatsApp voice notes to kind of get around these issues of translation, and seeing if people record, record their thoughts through WhatsApp. And this, of course, means that they're having access to a smartphone and data, but that's an interesting way, I think, to get at some of the qualitative data collection that doesn't require translation. But anyway, getting back to this idea around, do we need, is it okay to provide money or airtime for people in order to have them participate? And is there anything unethical about doing that at this point? Looks like Johnny, you've got an idea.
Someone else was, I'm like, I'll jump in if no one else is talking. I mean, I'd be interested if anyone kind of brought up what are the ethical thoughts, because I think that would be quite nice to kind of like, what are those ethical challenges that you're considering? I definitely think it's an approach to give airtime, like kind of like shooting from my hip. Be like, yeah, totally. But that's how we always think about everything, isn't it? Yeah, that's fine. But we're definitely looking at that in one of our programs. The thing is, they're not going to just use it to call you for your monitoring. So I think it has to be, it's like a cash program. You know, if you're giving people cash, they're going to spend it the way they're going to spend it. And so I think it's, you know, what does that kind of, how does that translate? I guess is it, you know, restricted airtime, or is it just unrestricted airtime from a cash perspective?
Yeah, I think so. The other issues are, does it skew your data? Does it, you know, does it create weird incentives, motivations for people to participate in one thing versus participate in something else? If one evaluator is providing phone credit and another one isn't, I think there are a lot of really interesting things I would love to see. I think there are so many new areas of research that are coming up around remote monitoring, and things that really should just be researched and looked into. And, you know, one of the things that we're thinking a lot about, as, you know, just as a community, as a MERL-tech community, is that we don't have nearly enough monitoring and evaluation on ourselves and our own approaches, and the effectiveness of our own approaches when we start to integrate technology into monitoring and evaluation. Are we studying ourselves? Are we using experimental approaches to understand, you know, what different technologies do when we add them into evaluation? So I want to move over into this area of do no harm, because we have about 15 more minutes today. So one of the questions that's come in is a question around mental health. And are we really just kind of burdening people who are, you know, concerned about their finances? We know that gender-based violence and child abuse could be on the increase because people are trapped, you know, kind of trapped in their homes with potentially with abusive partners or abusive parents. People are worried about money. People are worried, maybe they're worried about their own health. Do we really want to kind of burden people with this expectation that now you should be responding to our survey? So I think that's one question that's come through the chat that I think is quite an interesting one around this idea of harm. Nasia, I see you're unmuted. Do you have any thoughts on that one?
Yeah, no, I think that's a very good question, and also, like United is going in the same direction as some practical kind of questions to increase response rates. Like there are feasible to us or not, or what could have, like, you know, some kind of unexpected or indirect effects is useful. The other thing is,
can you go back and repeat, because you cut out a little bit, so I didn't catch the first part. I'm not sure if others also missed the first part of your response.
Yeah, so I was saying that asking, getting an idea of what questions are feasible to us and not, like over the phone, I think is pretty important, and we have been doing some piloting about that. I think piloting is pretty central, and it ties back to the first point I was trying to make, that a lot of this needs to be very experimental in each context where we are trying to operate. Also, to your point, I said this is always a good reason not trying to burden. Like, there is always a cost from data collection that is not only the financial and the logistical cost, but the time of the respondents, and I think it's not uncommon to compensate then for some of that time, but also checking what number of minutes is optimal to get responses. I think it's an important consideration.
Any other thoughts from Ayanda on this point?
I'm good. I think I'm covered on this one.
Yeah. Okay. Great. Jana?
Yeah.
No. Okay. Great. Just kind of looking down here, back into the chat. There's a comment from Dugan saying that we need to be more mindful about kind of this entire the entire program, and I think really this is a question around potentially a question around extractive data collection. I really liked the point that you raised, Diana, about the data being useful for people who are collecting it, and data not just kind of being extracted and going up the chain to someone somewhere else, but how's that data used? How does it help people understand their local program approaches? How does it help people even understand their own lives in their own in their own communities? So I'm curious a little around whether remote data collection contributes to doing that better, or if it creates challenges and barriers for people using their own data locally to make their own decisions. I guess I'm kind of directing that to you, Ayanda, but others can also comment if you have thoughts.
So I think for me it depends on how, so in terms of the methods that are being used to collect that data, and I guess in a way, if the data is collected in such a way that the individual who's sharing that data is actually getting feedback, and it's helping them to be more informed, and therefore or certain insights are that data that the person can benefit from, then that method is enabling or supportive for the. But I think a method is, literally just getting a set of information from that person, and the great thing that they get out of that is thank you for your time. Then I think in that instance you would have extracted the information. And I do know and appreciate that some of the methods as well, where it may be, just thank you for your time, it's actually part of a broader effort that will to, for instance, a community initiative or an initiative that is going to benefit the different stakeholders. But what tends to happen as well is that the feedback loop, right? So it's like, we got the information, but to what extent do we keep the stakeholders and see the data owner as a stakeholder of their data, and also the initiative, and that they're kept in the loop as to the developments of what has happened with that information and how then it fits into the broader initiatives. Because what tends to happen is that the data is extracted and then people go away and they get quiet. We understand there are programmatic and decision-making and proposals and other things that go on, but we tend to neglect the data owners in the process. So I guess in short, it depends on the method and what the data is being used for.
Thank you so much. So in the last few minutes that we have on the call, I would love to, this is kind of an experimental approach myself here, but one of the things we really wanted to get out of some of these sessions are some of the key questions that the community, this kind of community of people who are working on these issues here on the call. What are some of the questions that you would like to have answered if there were going to be research, or if people were going to start doing some kind of research and monitoring and evaluation on their own use of remote monitoring, for example? What are some of the questions, the big questions that you would have? I would love for people to kind of drop any of those into the chat so that we can build those into our kind of follow-up work that we might be doing here. I really love this idea someone popped into the chat about doing remote data by design, and really rather than just thinking about how do we take what we've always done on paper and how do we try to do it probably less effectively using using digital tools, but how do we really think from the very beginning, if we were going to be doing remote monitoring, what are some of the elements that we can be more creative about? What are some of the things that technology might allow us to do that we haven't been able to do? What are some of the gaps that we know that technology is not going to be able to fill, so that we can look at some kind of a mixed methodology or different ways that we could think about really using these types of tools to their fullest extent, but also recognizing the gaps that they have. Any thoughts on that? I really, really would love any just, really basic questions or complicated questions or anything that people want to drop in the chat that will help us to start thinking about what we might try to do some research on going forward. But also any thoughts from anyone who is on the panel today. Ignacio?
Yeah, I think some central questions are about the quality of the data that we are deriving from with these methods, specifically in each context, quantifying the exclusion errors, also like, seeing like what is the differences that we get, like, from in-person data collection to phone data collection. And also, like I said, it's very important, like, this piece about figuring out if we can ask some sensitive questions, what are the repercussions of those, like this, very important. And more like, on the horizon of where these things can go and what they can help with, I think that the specifically two-way communication platforms, like based on WhatsApp or other methods, hold a lot of promise to collect data that will be very difficult to collect otherwise. And I would like to emphasize this MERL-tech example, collecting information, I think it was in only 3 weeks or 2 weeks of 800,000 South Africans on their health conditions. Like, I think that was a very big achievement. It shows like some of the possibilities of these methods.
Great. Ayanda, Jana, do you have any thoughts on sort of areas for greater research? There are a couple of things that came in through the chat that I really love. One is a simple overview of just opportunities and threats would be useful. So kind of like a really basic opportunities, threats, risk model. That's a really great one. But go ahead if you have any other thoughts.
Just a couple of thoughts on that. I think one really basic, I've dropped these into the chat as well, just in case. One really simple one was just how much data do we actually analyze? So from like what I see, most people collect like tons of data and they analyze only a little bit of it, and that gets reported. And I think it's really important that if you think it's important enough to collect, then we need to also be really giving people the dignity to analyze it. So that would be one quality monitor. But the other thing, I think one thing I find as I present data back to program managers is sometimes they'll be like, oh, but that doesn't look, as good as I wanted it to. And I think as M&E practitioners, I think it's our job to say, like, I'm not here to like say your program isn't doing a good job. I'm just showing you that this area might not be as good as you thought it was. And so I think instead of judging people, I think just creating a safe space to say we're learning, because I think the more data you collect, especially in remote programs, if you're really being honest with yourselves, you're not going to be creating this amazing impact all the time that you think you are in every single way that you want to be. So I think just allowing that space and people to just understand that it's not about judgment, but it's about like, these are people's lives that we are impacting. And so if we aren't truthful with what the data is saying and following up on that, then actually we could be showing harm. So I think people have a lot of pressure that the M&E has to show good impact. It has to show 90% improvement. And there's so much pressure, I think, through indicators and that kind of thing. And I think there is a culture change. I don't know how you monitor that. So constantly up against.
Great. And then I want to hear if you have any thoughts, Ayana, but before that, Dugan is asking for any suggestions, if people also want to drop into the chat, suggestions on what a good practice guiding document could look like. We already have a few thoughts in there, but what kinds of things would people like to see if we wrote some kind of a short document around remote monitoring, good practices, examples, case studies? What kinds of things would people like to see in there? Or do you have anything, would you like us to get in touch with you? Do you have anything to share in a document of that sort? So go ahead and drop your contact information in the chat if you'd like to be involved, or if you have something that you'd like to share or talk to us about there. Ayanda, just any last thoughts around this this question?
Yeah, so on my side, it's three points that are related. I think the first one is around existing data sets that can be leveraged. So just understanding what we already have, so that we don't have to get it over and over again, and establishing sharing protocols around it. And then the second one is then like a fit for purpose, like data collection or remote monitoring practices, particularly for those hard to reach areas, because I think sometimes we are too hard on ourselves, and we're trying to solve the M&E problem, but we're also trying to solve the underlying problem of people having certain systems in place, and as well as, I think related to that is this idea that there are ways that those communities are working and are able to communicate and engage with the rest of the world. So it's about how we then benefit from those as well. And then a third one is really around then standards. What are some of the standards, particularly around data, if we're going to share it, if we're going to reuse and benefit across the board. So what are some of the standards around that information?
Thank you so much. So we have just about one more minute, and I just want to use that last minute to thank Ignacio and Jana and Ayanda for being with us today and sharing their insights. Thanks everyone who came and participated today, for being here, for sharing your thoughts in the chat. Even if you didn't share thoughts in the chat, we know you've got lots of thoughts that you're already thinking about. So please feel free to get in touch with any of us if you'd like to chat afterwards. And I also want to thank Talita and Dugan for kind of joining in this partnership with us to try to figure some of these things out. Really, really fun to hear all of this today. I thought it was really interesting. I'll send out a report to everyone who had signed up. I'll add the links that people have dropped in the chat. We'll be back in touch with folks that are interested in being more involved. And I think that's it. We do have one more session tomorrow around use of administrative data for monitoring and evaluation, specifically in COVID. So we've got some really interesting people that are going to speak with us about their country level experiences tomorrow. And I think that's it for today. And thanks again, everybody, for